This unprecedented need for nurses has really put us in control. It put us in the driver's seat.
Staffing shortages, supply issues, poor pay, this all existed prior to the pandemic.
The nursing profession has learned its worth and learned that we are not disposable.
The issues were not created by the pandemic. The pandemic was revelatory.
There isn't so much a nursing shortage as much as there's a shortage of nurses willing to work in these conditions.
I actually graduated in a pandemic. So all I've known is, frankly, sheer chaos. I feel that healthcare in general is going through a major crunch right now. There are massive opportunities for improvement, but also it is a staffing issue at the end of the day. And I think for me, having only a year of experience starting in the ICU, I was a charge nurse. That means that I'm basically the nurse supervisor. Someone that has 1 year experience is supervising an ICU where people receive fresh hearts.
I've been an emergency room nurse for 4 years. I would have 10 patients, 12 patients all under my name. And I always knew this was unsafe, but I started to feel really unsafe when the pandemic happened and patients were sicker and sicker, and I was still taking care of that many patients. Going into emergency nursing, it's not going to be the easiest specialty, and nursing in general is definitely not the easiest job, just definitely something that draws you to it. And I always liked the excitement. I always liked running around and getting to be super involved and at the bedside a lot. And that all just kind of started changing when COVID started happening.
Oftentimes we would have to invoke what is called safe harbor, and that's to protect your license in the event that you deem an assignment unsafe. And so that's what led me to start looking elsewhere and pursuing, is this just indicative of my institution, or is this system-wide, and maybe travel will provide an opportunity for me to explore my role as an ICU nurse.
Previously, I was a full-time registered nurse at a pediatric facility in Phoenix. And as the pandemic started to ramp up and there was need in a traveling or contract-centered workforce, I started picking up contracts locally in Arizona. When I graduated in May, I went full-time on the road and have been taking travel contracts ever since then. The pandemic kind of presented a new set of needs that we really hadn't experienced before. As the needs continued to evolve and develop, I was able to continue to learn new things in, epidemiology with COVID testing and contact tracing, and then moving into vaccination. It was just a new set of needs that as a staff nurse, I really didn't have an opportunity to be exposed to. I'm working on cruise ships now as an independent contractor, and so I am currently the team lead charge nurse, and we are doing testing to do COVID surveillance and then providing that to the ship for them to be compliant with the CDC's conditional sail orders. So absolutely amazing opportunity to sail the seas and also get to do some COVID testing and still work as a nurse, but enjoy the sunshine on our days off as well.
I felt like being a travel nurse, my worth would at least be a little bit more realized.
The main reason I decided to travel, I think a lot of people will say a lot of different things, but in their heart of hearts, the answer is money. Travel nurses get 4 to 10 times more than they would per week.
For me personally, I felt like if I was doing the work of 3 nurses, that I should be getting paid that way. And that's why I decided to go into travel nursing. I knew leaving my full-time job for another full-time job wouldn't really fix a bunch of the problems that I currently had with being a staff nurse. Right now, nursing in general, you're gonna be worked way harder than you should be worked. And you're probably gonna be unsafe in a lot of emergency departments right now.
A lot of people at this point are like, if I am risking my safety and my welfare and my health and having to basically not interact with family and make certain decisions, life-altering decisions because of my occupation, I should be compensated for this.
There's a lot of moral injury. There's a lot of burnout. There's a lot of amazing nurses who have an amazingly specific skill set, and they're like, I'm done. I've seen too much and my heart is too heavy. And then if you do go into the hospital, they are short-staffed, and the people that showed up are the people that showed up knowing they were going to be short-staffed and have a crazy shift.
It's often the nurse that gets the brunt of things because why? We're in the room the most.
It's not just COVID numbers being directly related to how hard it is. We're already working in such a broken system and such a system that's at capacity all the time that even just adding a couple dozen COVID patients is really, really felt.
It's really a dire situation that travel nurses do come in to try to mitigate, but at the same time, we're all still only human. And when the demand for patient care exceeds what our emotional capacity allows, it's really a distressing place to be as a healthcare provider.
Without nurses, a hospital would not run.